Hey, good morning, everybody. Thank you for joining us for our webinar today on Medicare Basics. I'd like to introduce Lynn Elinson. She's a volunteer with the Health Insurance Information Counseling and Assistance Program. She's going to give a presentation. I'm going to just mute everybody for that, and then if you have questions afterwards, you can unmute yourself or type your question into the chat. So take it away, Lynn.
Okay, well, hello everybody. We're a small group today, very intimate. It's almost like a one-on-one counseling session, which we also do at South Huntington Public Library and other libraries throughout Suffolk County. But I'm still going to take you through the Medicare Basics, give you an overview, because I think it's useful to see Medicare sort of from a high level. And then I'll talk for about maybe half an hour. Then we'll take your questions. And then if your questions still aren't answered, I have a slide that shows you where you can go if you have more questions as well. So as Catherine said, I am a volunteer for HIICAP. See if I can, how do I get this to go down? Sorry, Catherine, I'm not getting this to move. I'm sharing. There we go. Okay. HIICAP is Health Insurance Information Counseling and Assistance Program, and it's actually a federally funded program. Many states have HIICAP or have some other way of helping people in the state to navigate Medicare, primarily because it's so complicated. If any of you have done any reading so far, you will probably agree with that. So in Suffolk County, HIICAP is actually administered by the New York State Office for the Aging through the Retired Senior Volunteer Program, RSVP of Suffolk. And what we do is we provide free and unbiased information about Medicare and Medicare-related insurance and financial assistance. So we are not allowed to give you recommendations, but we try and tell you all of the information that you need to know or where you can go to find more information so that you can make thoughtful decisions on Medicare. And all of this information, we have a coordinator, but all this information is provided by volunteers like myself. So today I'm going to just cover the basics, start a little bit with the history, just a little bit of that. Talk about what Medicare is and how it works, and then talk about the different parts of Medicare, because you may have heard about that on TV commercials, and that's where it starts getting a little bit more complicated. There are special times of the year when you can enroll in Medicare, and there are also special times of the year coming up now, actually in the fall, when you can change the different plans that you're on. If you're on a plan that you're not happy with, or you want to change the way you're getting Medicare, then the fall open enrollment is when you can do that. Now, you'll see that there are certain costs to Medicare, and so I'll talk a little bit about the programs that help you to pay for Medicare, and then finally, where to go if you have more questions or where you need specific help. And then, of course, we'll take your questions as well. So first, the history. The Social Security Act of 1935 actually had a section of it for healthcare. And that was last minute taken out by Franklin Roosevelt because he felt it was too controversial. So it wasn't really until 30 years later that we got Medicare combined with Medicaid under an amendment to the Social Security Act of 1935. And so that was in 1965, where Lyndon B. Johnson and Congress at that time enacted Medicare and Medicaid. And Medicare at that time was enacted as Original Medicare, or Parts A and Part B. And we still have Part A and Part B today, but Medicare has been expanded. And the first time it was really expanded was in 1972 during the Nixon administration. Originally, Medicare was for people over the age of 65 and over, but it was expanded to include people with a disability who had had a disability for a certain amount of time. Then in 2003, during the Bush administration, we got Part D, or private drug plans. And then finally in 2010, as part of the Affordable Care Act, there were some sections in the Affordable Care Act that related to Medicare. There were preventive services that you can now get where you don't have to pay any co-pays. And you may have heard of the donut hole, which we'll talk about later. The Affordable Care Act has virtually closed the donut hole, although not completely. So these were added during the Obama administration in 2010. Excuse me. So Medicare is a federal program. It provides health insurance for people over the age of 65 or 65 and over, but also for people who are under 65 who are receiving Social Security Disability Insurance, or SSDI. There are two programs under disability programs under Social Security, and the SSDI one is the one that is related to Medicare. Also, people with kidney failure requiring a dialysis or transplant are also eligible to receive Medicare. So what are the different parts of Medicare? Well, we talked about original Medicare, Part A and Part B. And Part A is where you are covered if you go into the hospital and you stay overnight for one night or many nights. And so basically these are inpatient benefits. Part B are your doctor's visits and your outpatient benefits. So if you are actually in the hospital in the emergency room and haven't been admitted to the hospital, so you're considered an outpatient, your benefits are coming under Part B. Part A is only when you are admitted to the hospital. Part D is your prescription drug benefit. Now there's also something called Part C that many of you have heard of on a number of advertisements that I know I see all the time. These are for Medicare Advantage plans. Some of these are what are called HMOs or PPOs. They're different ways of getting Medicare, but you're still considered to be, to have Medicare. You are getting Medicare through private insurance companies, through private insurance plans. And what happens is that the Medicare actually contracts with these insurance companies to provide you with Medicare benefits. So it's not a separate benefit. Everyone who has Medicare Advantage still is considered to have Medicare. So when you are applying for the first time to go on Medicare, you really have to make a few decisions. First of all, step one is that you want to decide how you want to get your coverage. Do you want to get covered through original Medicare, or do you want to get covered through a Medicare Advantage plan? Now, if you decide you want to get covered through original Medicare, you are going to be receiving benefits for Part A, so that's hospital benefits, and then also for Part B. But it's not going to include anything related to receiving benefits for your drugs. So what you would need to decide is whether you want to get a Part D prescription drug plan. These are private plans. They're somewhat optional. If you don't get a plan when you're eligible to get a plan, you may have to pay a penalty when you decide that you do want a drug plan. But if you're getting your drugs from another plan that's considered to be a creditable drug plan, then you don't need to get drug coverage under Medicare. Now, Medicare has a number of co-pays and co-insurance and deductibles that I'll show you in a minute. But because of that, a lot of people also want to get a Medicare supplement or Medigap. And so that is not, that's totally optional. And you'll see what some of those Medicare supplements cover. Now, The other way you might want to get your coverage is through a Medicare Advantage plan. Now, those are considered to be, in a sense, one-stop shopping. They include Part A, they include Part B, and possibly Part D. You have your choice of getting a plan with a Part D or without a Part D. This thing seems to have a mind of its own, so I'll just keep going back if it skips forward. So you have the choice of getting a Part D included in your Medicare Advantage plan. One reason you might not want to get a Part D is because you're getting it through another type of coverage. For example, a VA coverage, for example. So you would not have to get a Medicare Advantage plan with a Part D included. If you do, then that's the end of it for your Medicare Advantage. You basically decide which plan you want to get, but you cannot get a supplement. Supplements are only if you are getting original Medicare. So that means that there are going to be copays and there are going to be deductibles for Medicare Advantage plans, but those are all going to be out-of-pocket costs that you won't have a supplement to help you to pay for those. So how do you make a decision on whether you get original Medicare or Medicare Advantage? So let's compare them. The traditional program is basically original Medicare. It comes directly from the federal government, and it's accepted by most doctors and hospitals in the United States. So if you're on original Medicare, you can go to pretty much any doctor, any hospital, any healthcare provider in the United States that accepts Medicare. But you do have to get a separate drug plan because original Medicare does not include a drug plan. And then you have the option of also purchasing a Medigap or supplemental insurance, and this can help you to pay for your out-of-pocket costs, your deductibles, and your co-insurance. And I'm going to show you the prices of some of these, so you're going to be able to see the difference in costs between original Medicare and Medicare Advantage. Now, Medicare Advantage, on the other hand, are Medicare benefits. Remember, you're on Medicare if you have Medicare Advantage, but you're doing this through a private health plan, and they must offer you the same benefits as original Medicare. The thing is, they offer it differently. So the main way that it's different is that you're often limited to the doctors and the hospitals that are in the network of the particular plan that you choose. Different plans have different networks, so when you're choosing a Medicare Advantage plan, you want to make sure that the doctors that you want to go to are going to take your Medicare Advantage plan. So that's something that you have to do a little bit of background work yourself. You usually can get a drug plan from the same Medicare Advantage plan. So they almost in every case, you'll see, include a drug plan. You also want to make sure, though, with the drug plan that they cover the drugs that you're taking. That's the case with the standalone drug plans as well. And one advantage that people often see in Medicare Advantage plans is that they also may offer additional benefits, benefits for hearing, vision, and dental. In fact, all of the ones that are available to you this year in Suffolk County, they do all offer hearing, vision, and dental. It's going to be slightly different for each plan, so you have to see exactly what they're offering, but they do all offer something. Okay, I usually do this in person, so I'm handing out these tables, but I wanted you to see some of the information starting with the drug plans. So this page and also the next slide lists all the drug plans that would be available to you in Suffolk County. And I guess the things you want to look at are the column that shows the monthly premium. They all have a monthly premium and they range in price. The cheapest one is, it looks like it's 13, I don't know if I can, yeah, I don't know if you'll see my marker there, is $13.70. So that's what you would have to pay for Envision Insurance, Envision RX Secure PDP. You'll also notice, I'm sorry, it's Envision RX Plus PDP. But down at the bottom, you'll see that Silver Script the monthly premium is $91.20, but it doesn't have a deductible. All of these others have deductibles as high as $435. One is $100. So you want to look at what the drug premium is, the monthly premium, and also the annual drug deductible. And then also the second page has the rest of them. For people who tell me they don't really take any drugs, but they still want to be on a drug plan, they'll often go by the price of the monthly premium. But you want to be really careful if you're taking certain drugs, especially brand name drugs, and you want to make sure that the particular drug plan that you choose actually covers the drugs that you're taking. So one way to do that, you could of course call all of these, and we've given you the phone numbers, but another way is to go onto the Medicare website, www.medicare.gov. And there's a section of that website where you enter you type in the names of every drug that you're taking, and then it will list all of the plans and how much it will cost you each year, for the following year for each plan. So you'll get to see which are the cheapest plans, which ones cover the drugs that you're taking. So if you're taking any drugs that are more than generic drugs, but are brand name drugs, because those are the expensive ones, you're gonna want to try and go onto the Medicare.gov website. And HIICAP can help you. If you make an appointment and want some help doing that, we can certainly help you to do that. Now, I mentioned that there are costs with Medicare, and I want to show you some of these costs because when we talk about the supplements, you want to know what those supplements are actually helping you to pay for. So first of all, your Part A, remember that's for hospital. That's usually, the premium is usually free for people who have worked for at least 10 years because all the time that you've been working, you've been putting money into that Part A pot of money. So you've actually been paying for your Part A over the years that you've been working. So typically Part A is free for people who have a work history, or if your spouse has a work history, but it can be up to $458 a month if in fact your work history has been limited over the years. Now there's also a deductible for Part A. If you go into the hospital, every time not every time you go into the hospital, but there's something called a benefit period. And there's a deductible for each benefit period of about $1,400. So a benefit period, you see the footnote at the bottom, it begins the day you're admitted as an inpatient in the hospital or in a skilled nursing facility, SNF, and it ends when you haven't gotten any inpatient hospital care or skilled care in an SNF for 60 days in a row. So if you go into the hospital in January and then you go again, let's say 2 months later, even if it's for a different condition, that's still within the same benefit period. If you go into the hospital in January and then in August you go again, then you're going to have to pay a second deductible of $1,400. Now, the first 60 days in the hospital are free, but then after that, then there are costs for 61 to 90 days and then for 91 or more days. And you'll see that your supplements will pay for these costs and will pay for your deductibles as well. There are costs for being in a skilled nursing facility. People also call that, that can be rehab, for example, if you're in the hospital and then you go into rehab. The first 20 days are free, but then after that, the costs are $176 per day. And so you want to make sure, or you know, if you have a supplement, then those costs will get paid for. There's also a Part B premium. Now remember, Part B is your doctor's visits, your outpatient coverage. And so that premium is typically $144.60 if your income is $87,000 or less, if you file as a single person on your income tax, or $174,000 for couples. So that's your Part B premium. And then there's also a Part B deductible and coinsurance. So that deductible actually has been going up over the years, but it's now close to $200, $198. So you must pay out of pocket $198 before your Part B coverage starts kicking in. Also, there is 20% coinsurance, which means that Medicare covers 80%. You probably see these on TV all the time. Medicare covers 80%, and you have to pay 20% out of pocket. Again, you'll see that most of the supplements will pay for this. And then your other costs are going to depend on the plan that you get. If you decide you want to get Medicare Advantage, it's going to depend on the plan you get. And also it's going to depend on the premium for the Part D if you get a standalone Part D. Okay. So let me just talk briefly about the Medigap or supplemental insurance. It's optional. It covers some or all of the copays, coinsurance, and deductibles in Medicare. And the plans vary in what they cover. You may have heard of F plans and G plans and A plans, and that's part of what makes, these are A plans, but not the Part A. It's different than the Part A that we talked about before. So this slide shows you what the different levels of plans cover. So the F plan is going to be the most comprehensive. Can I get my, here it is, my marker. Because you can see there's a little diamond in every one of these things. Every one of these benefits gets covered with an F plan. The F plan and the C plan are actually no longer available to people who are going to be new to Medicare. So starting January 1, 2020, people who are new to Medicare cannot purchase an F plan or a C plan. But the G plan is very similar to the F plan and the C plan. The only difference is that the F plan and the C plan would cover your Part B annual deductible. So that's that $198 that you have to pay out of pocket before your Part B coverage starts to kick in. Another plan that people look at compared to the G plan is the N plan. And let me just show you the differences between those two. The N plan, every time you go to a doctor, you do have to pay a copay of up to $20 if it's for an office visit, and up to $50 for an emergency room visit. So for people who say they don't go to the doctor very often, sometimes this doesn't amount to that much over the year. It pays for the same kinds of things as the G plan pays for, but it does not pay for that deductible. Neither does the G plan now. Only the F plan and the C plan pay for that. And if you're new to Medicare, you cannot purchase those plans. And then it also pays 80% of emergency care outside the US like the G plan does. And as far as out-of-pocket limit, that's not applicable to most of these plans, except for the K plan and the L plan, which basically pay you reduced amounts until you reach that limit. And then once you reach that limit, then they start paying for everything. So I just want to show you what the costs of those plans are. These are the different companies that sell the plans, and not all companies sell all plans. For the G plan, it looks like everyone is selling a G plan. You'll notice that there's quite a range of difference between the monthly premium for the G plan for a lot of these plans. So that Bankers Conseco is almost $600 a month, whereas United Healthcare from AARP, which has been one of the more popular ones, because of the price, is $270. So is Blue Cross Blue Shield. Those are the two lowest cost plans, the G plans. The N plan, which we just compared the G plan to, is $200 for the United Healthcare plan and $192 for the Blue Cross Blue Shield. So I just want to tell you that if you get any one of these plans and you see that there's a range in cost, I do want to warn you that the more expensive ones, even though they're more expensive, if they're advertising a G plan, then they have to give you everything that a G plan gives you. And so the United Healthcare plan or the Empire Blue Cross Blue Shield is much cheaper, but it's still going to give you the same things that the Bankers Consejo is going to give you. So just be aware that these plans have to give you what they're advertised to give you. Okay. Now, just getting to Medicare Advantage or Part C, remember that's the all-in-one plan that combines Part A, Part B, and Part D. These are Medicare services that are provided through a private health insurance plan, and you still have Medicare. You also have to pay your premium for Part B, and then there's a separate premium for the Medicare Advantage plan. Some of these plans, most of them actually, you'll see, include a Part D, include a drug plan, and they also include benefits such as dental, vision, and hearing. And they're all going to vary, you'll see, with their copays, their different restrictions that they have, the premiums that they have, the deductible for their drug plan. But the biggest difference between Medicare Advantage and Original Medicare, remember, is that with Original Medicare, you can see any doctor throughout the United States, but in Medicare Advantage plans, you can only go to the doctors that are and the hospitals that are in the network of the Medicare Advantage plan. So these are the plans, and some of the companies are Aetna, Emblem Health, Humana, United Healthcare, WellCare, and you can see that their monthly premiums are all different. And some of them have, actually most of them have a drug deductible. These do not, down at the bottom, the WellCare. And they all include extra benefits, dental, vision, and hearing. They all have what's called a maximum out-of-pocket limit, so that once you have paid the amount that's listed in this column out of pocket for your Part A and Part B services, then they cover you almost completely. Coverage offered in the gap, we saw that, but we didn't talk about it. Remember, the donut hole is the gap for your drug coverage. And what that meant is when you reached a certain amount that you paid for out of pocket with your drug plan, then you would go into the donut hole, and then your costs would get higher. And then after you, and so that's the donut hole, that's the gap, the drug gap. And then when you paid more, you're paying more now for your drugs, and when you reached another amount, I think it's up to $6,000, then you have catastrophic drug coverage, and so your drugs are almost completely covered by the plan. So some of these cover you in the gap, and some of these do not. I mentioned that the gap, or the donut hole, was closed. It was almost completely closed, but you still have to pay 25% for the particular drug that you're taking if you're in the gap. And for some drugs which are very expensive, that 25% could be costly, or it might amount to not very much. So it depends on the drugs that you're taking. Okay, so these are your Medicare Advantage plans. You want to make sure that if you choose a plan, that you can go to the doctors and the hospitals that you want to go to. You might, if you have particular doctors or hospitals that you care about, you might want to call their business office and find out what plans they actually take. If you're a doctor that you care about a lot, it does not take any of these plans or doesn't take one of the plans that you want to get, then you might want to consider getting Original Medicare. Okay, these are the same plans, but I just wanted to give you an idea of the co-pays that you would have to pay for each of these plans. Some of them have no co-pays. For example, United Healthcare Medicare Advantage Choice Plan 1, there's no copay if you go to a primary care physician in network. If you go out of network, there's a whole other column. There's other costs, and they're going to be much higher for the copay that you would have to pay. And $45. If you go to a specialist, then your copay for this one is going to be $45. So you can see that each of them are different. This particular one, Emblem Health VIP Gold Plus, has no co-pays. Let's see, Emblem Health VIP Gold, but it's $300 a month for your premium. So you're kind of weighing how you want to pay, basically, and what you have to pay. One of the things that you might want to do is also go on the Medicare website, www.medicare.gov, and look at the different Medicare Advantage plans that are available to you. And it will give the details of all the different co-pays that you have to pay, co-insurance that you have to pay. And I'm not sure if it lists the doctors and hospitals that are in the network. You might have to contact the plan specifically to find that out, because they change all the time, and you have to be aware of that you may be going to a doctor that the plan will, the doctor can be covered in that plan, and then the doctor leaves the plan. So these things do happen from time to time. Just want to remind you that Medicare does not cover certain things. Most dental care, most vision care, routine hearing care, hearing aids, foot care, most long-term care, alternative medicines such as experimental procedures and acupuncture, which isn't really, it's alternative, but it's certainly not experimental at this point, but it's not covered necessarily under Medicare. Most care that you receive outside the US is not covered by Medicare unless you have a supplement. Personal care or custodial care, if there's no need for skilled nursing care or any kind of skilled care. So Medicare does not cover long-term care. This is something that you would have to get separately from any of the costs from Medicare, and most non-emergency transportation. Now, remember, Medicare Advantage plans and Medicaid as well will cover some of these services, but Medicare, or certainly Original Medicare, does not. So I think we're now at the point where, this is what Medicare gives you, but how do you enroll in Medicare, and when can you enroll in Medicare? And maybe some of you are interested in hearing about Medicare because you're starting to, you're approaching your 65th birthday, or there may be other reasons or other times when you can enroll in Medicare. So first of all, there are 4 ways to enroll in Medicare. First, for some people, it's automatic. You're just going to receive your Medicare card in the mail. There's also something called an initial enrollment period, which I'll talk about, a general enrollment period, and special enrollment period. So the automatic enrollment happens under certain circumstances. If you're 65 and you're receiving Social Security retirement benefits at this time, or railroad retirement benefits, then you're going to get your Medicare card in the mail. If you've been receiving Social Security disability insurance for 2 years, then right before that 24 months or 2-year period, or if you've been receiving railroad disability annuity checks, then you're going to get your card automatically in the mail. And same for if you've been diagnosed with ALS, which is Lou Gehrig's disease, you're going to automatically be enrolled in Medicare the first month that you receive SSDI, not 24 months, but the first month. So you're automatically enrolled in Part B, but you're given the option to turn it down. And many people will want to turn it down because they are still working and they are getting their health care through their job or through their spouse's job. And so that's perfectly fine. That happens all the time. But you just want to be very careful. Don't turn down your Part B unless you have employer insurance or insurance from your spouse's current job, or otherwise you're going to have to pay a hefty premium penalty. Okay? So I want to talk about the initial enrollment period. This is coming to you when you're starting to approach the age of 65. It's a 7-month period. It includes the 3 months before your birth month, and the 3 months after your birth month. And so depending on when you enroll in Medicare, that's when your coverage starts. If you enroll before your birth month, then your coverage starts on day 1 of your birth month. So if your birthday is March 15th, but you enroll 2 months before, then your Medicare coverage is going to start on March 1. If you enroll after your birth month, then there's going to be a gap in coverage. So we always, and you're going to have to wait a month or even 2 months if you enroll in month 6 or month 7. So to avoid that gap, want to make sure that you enroll before your birth month. Sometimes people do it way before, and Medicare says it's too early, we can't deal with you. So, but if you start in M1, M2, or M3, then you will be covered starting on day 1 of your birth month, and there will not be a gap in coverage. Now, there are 2 other important enrollment periods. There are things called special enrollment periods. There are a lot of examples of when you might receive a special enrollment period. If your plan no longer offers coverage or terminates a significant amount of its network providers, or move. But the one that's most common for you to get a special enrollment period is if you are working and then you retire from your job and then you no longer have health insurance. Or if you're getting health insurance from your spouse's job and your spouse retires, then you're no longer covered. So if that's the case, you have a special enrollment period, and it lasts actually 8 full months, which means that you have 8 months to enroll in Medicare. You're going to want to do it, though, before you retire. So again, you don't have a gap in coverage, but you do have 8 months to enroll. So that's your special enrollment period. There's also a general enrollment period, lasts from January 1 through March 31st. You can sign up for Part B with coverage beginning in July. But if you use this, you're going to be incurring a late enrollment penalty. Now, drug plans, you can enroll at the same time that you're enrolling in Part A and Part B. So during your IEP, your initial enrollment period, you can enroll in Part D at the same time. Again, you want to enroll before your birth month, so there's no gap in coverage on your drug plan. And you can also enroll or make changes to Part D during fall, which we'll talk about in a second. Part C, Medicare Advantage enrollment, you can enroll again during your initial enrollment period when you first qualify for Medicare, when you are approaching age 65, or if you have a disability and you've been getting SSDI and you're approaching your 24th month of that, then you can enroll in a Medicare Advantage plan at that time. And you can also enroll in a Medicare Advantage plan during a special enrollment period. For example, if you're retiring from your job and you lose what's called your creditable health insurance coverage from your job, then you can enroll in Medicare Advantage. And again, you can change your plans during fall open enrollment. In order to enroll in Part C or a Medicare enrollment plan, you must have Parts A and Part And then a Medicare supplement in New York State, it's not the case in every state, but in New York State, you can enroll at any time. Companies can't deny you coverage or charge you more because of your health status. And also people in New York State, again, this is not the case in every state, but in New York State, people with Medicare under the age of 65 have the same rights to buy a Medigap plan as people who are age 65 and older. So if you're on Medicare because of a disability, you also will be able to buy a Medicare supplement. You can find all the different supplements again on the www.medicare.gov website, and we can help you to go through those plans and talk to you about them. And then you can decide which plan you want, and you can call the plan to enroll. You have to call them, you can't enroll online. I just want you to be aware of some penalties and extra costs for Medicare. If you enroll late in your Part B, then you're going to have a late enrollment penalty, which will get tacked onto your Part B premiums. And it depends on the amount of time that you didn't enroll in Medicare when you could have enrolled. Same for Part D, there's a late enrollment penalty, and that penalty gets tacked onto your Part D premiums, your drug premiums, so that you will be paying more than what the plan actually costs. And then there are also, I mentioned this before, your Part B premium will be higher, and your Part D premiums will be higher if your income is above $87,000 as a single person, or $174,000 if you file your taxes as a couple. So changing plans, things may change in your life over the year. And so you may want to change your plans or the way you get Medicare. So you can do that most easily during what's called fall open enrollment. That's October 15th to December 7th. You can change from original Medicare to Medicare Advantage. So you may think, well, I'm never going to the doctor and I'm paying all this money for my supplement. Maybe I'll just try Medicare Advantage this time. You can make that change during fall open enrollment. You can change your Medicare Advantage plan to original Medicare. You may be going to the doctor a lot, and you're paying a lot of co-pays. You're getting charges that you never thought you would get. You can change during open enrollment from a Medicare Advantage plan to original Medicare. And you can also change the Medicare Advantage plan that you have if you want to get a different Medicare Advantage plan, or if you want to get a different drug plan. Let's say you're using drugs now that are not covered in your plan, your Part D drug plan. You can change to a different drug plan during fall open enrollment. There's also something called Medicare Advantage open enrollment period. Goes from January 1st to March 31st. Here you can change your Medicare Advantage plans. You can change to a different one. You can leave Medicare Advantage and switch to original Medicare. And if you do that, you can at the same time purchase a Part D plan if you want to. You can or you don't need to. And what you cannot do during the Medicare Advantage open enrollment period is you cannot change from original Medicare to Medicare Advantage, and you cannot change your standalone Part D plan. So it's only basically changing your Medicare Advantage plan or leaving Medicare Advantage and switching to original Medicare. Now there's something called SEP 65. Let's say you enroll in Medicare during your initial enrollment period, and you get a Medicare Advantage plan with Part D. And remember that initial enrollment period is that 7-month period surrounding your birth date. So you actually, with the SEP 65, you have 12 months to change from Medicare Advantage to original Medicare. If you're not happy with your Medicare Advantage plan, you can actually change excuse me, to original Medicare. And you can also, at the same time, enroll in a Part D plan. And you can also get a Medigap plan, but remember in New York State, you can do that at any time. Okay, so we talked about the costs. I'm actually not going to go through all of the programs. I have the slides for them in case there are any questions, but there are a number of programs that will help you to pay all of these Medicare costs, which if you've been keeping track of all the costs can actually cost you a bundle at the end of the year. So there's something called the Medicare Savings Programs. They're actually Medicaid programs. You would apply through Medicaid, but they will help you, given you know, your income and your assets, they will help you with Medicare premiums, co-pays, and co-insurance. There's something called Extra Help, which is a program that helps you with your drug costs. It can pay for your premiums and also makes your drug costs much, much lower. In New York State, there's a program called EPIC. This is an actually really good program because it doesn't look at your assets. It doesn't look at, you know, whether you own a home, how much your home is worth, and other kinds of assets. But it's only open to people who are over the age of 65 and over. So if you're on Medicare because of a disability, you're not eligible for it. And then you could apply if you're eligible for Medicaid, and it's going to cover many things that Medicare does not cover. And there are going to be, as I said, income and asset requirements for each of these programs. I'm not going to go through them right now. I'm just going to flip through them, but we can come back to this if people have questions on them. So you may have questions that hopefully I'll be able to answer today, but you may want more specific information as well. So these are some telephone numbers and websites that you can go to for help. And I think you're going to be able to look at this again, because I know it's recorded, but if you want to take a quick picture with your telephone, this is an important slide to take a picture of. So if you need more information, you have specific questions, or you want to know where our HIICAP volunteers are, I'm at South Huntington Library once a month and also Half Hollow Hills once a month. Now I'm doing my one-on-one counseling by telephone, so is everybody else. But if you want to get in touch with a HIICAP volunteer, you can call our helpline and ask about where else you can, what other libraries you can contact to get in touch with a volunteer for one-on-one counseling. The telephone number for Medicare is here, and the Medicare website is actually, I think, very good. You can Google things. I find that very, very helpful if I have questions, but also you can search in the Medicare website. You can go onto the section of the website that helps you to find drug plans and Medicare Advantage plans and supplements, gives you information on all of the different plans. The phone number for Social Security is here, and you would be calling Social Security. Social Security is basically in charge of your enrollment, and also if you lose your card, for example, that's the number that you would call, or the website URL that you would go to. Nowadays, you can't visit your Social Security field office in person. And so if you want to talk to somebody from the field office that's closest to you, then what you need to do is go to the socialsecurity.gov website, and then you'll come up with the locator. You type in your zip code, and it will tell you which office and the phone number of the office that's closest to you. And that's particularly useful now when if people are losing their jobs or are wanting are retiring from their job and they're now going on to Medicare, they're going to have to provide certain information. And so I think it's helpful to actually talk to a human being. You can do it online, but if you want to talk to a human being, that's a good place to go. Now, if you are applying for Medicaid, There is an organization similar to HIICAP, only they, instead of providing Medicare information, they provide you with Medicaid assistance. So that they usually do it in person, but now they're not because of the COVID-19 pandemic. And so you can call this number and you can actually talk to a person that can give you advice on Medicaid. There's something called the Medicare Rights Center, which HIICAP volunteers, we actually go to them for advice for questions that we can't answer, but they also speak to individual clients. You can go directly to them, and their phone number is here. And they have a great website, Medicare Interactive, that you can basically type in your question, and a lot of things will come up to help to answer that question. And then Medicare always wants us to remind people that if you're seeing fraud, if your doctors are reporting visits that you never went to or other kinds of fraud, then this is where you go. You can either call or you can go online for that. Okay, well, I think at this point I will take questions. Sorry that I just went on and on. There aren't too many of you, so we'll hopefully be able to answer your questions.
If you want to ask a question, you can unmute yourself or type it in the chat.
Trying to find the chat.
Yeah, hi, Lynn. I have one quick question for you.
Sure.
Okay, first of all, thank you. You were absolutely wonderful.
Oh, thank you.
I learned so much. It's clear, concise. It was great. So in order to enroll, I believe you can enroll online. Which is the website that you actually go to? Is it the Social Security website?
Well, just go to Medicare.gov,
Okay.
www.medicare.gov, and you'll see immediately it will take you to where you can enroll online. The difficulty in enrolling online is that you're going to have to upload some information. Let's say you're retiring, you're going to have to show them proof that you were working and had been covered by your employer's health care. So for some people, you know, uploading a document is no big deal, but for other people, it can be a little bit cumbersome. So they may want to call their field office and figure out how to send in the materials.
Okay, so if you don't want to do the uploading, then you do it basically on paper. Is that it? It's an actual paper form?
Yeah.
Okay.
Yeah, well, there's a form that you will have to fill out. This is only if you're enrolling because you're retiring. So this is your special enrollment period. There's a special form that you have to fill out and your employer has to fill out, and then your employer has to send it to you, and then you have to get it to Social Security, and that's the uploading part.
Okay. So
it's
in
a
my
lot of different steps.
Okay, in my case, I'm already retired and I had insurance, which I believe will now become my secondary.
Okay.
So I'm just curious, what things are they going to need copies of, or will they?
Well, they're going to want to have proof that you were covered by some sort of creditable insurance. So, you know, you may have something that shows that from your human resources department. It's going to be different, I guess, for every single employer, for different employers. So it's going to be some kind of proof that you were getting health care paid for, or not paid for, but you were covered by creditable health insurance. They want to make sure there was no gap in your coverage.
Right.
That's
right.
what you have to show.
Okay. Okay, thank you.
Okay.
Hi, this is Carolyn. Can you hear me?
I sure can. Hi, Karen.
Okay. I've got a couple of questions. I'm sorry, I might have to make an appointment with you because I'm asking both for myself and for my sister, whose situation is more complicated. For me, I am enrolled in Medicare. I only have Part A because since I retired, I've been on my husband's insurance. He's still working.
Right.
And he's planning on retiring the end of next year. I know from a
So
friend.
Sorry, Carolyn. So the end of 2021?
Correct.
Yeah, okay.
And so I've got a lot of time to make decisions. However, I've been thinking I need to research what my options are, like maybe my Medicare coverage would be less expensive than his employer insurance. But the thing is, I've been, a close friend of mine has already been through this entire thing, and she wound up with an F plan. Now, can you refresh my memory, please? Yeah, F as in Frank.
Okay.
Now, what I can't seem to absorb is, okay, A is hospital, B is, what I'm planning on doing is eventually going on to original Medicare with a supplemental plan.
Right.
Because that seems to me to be the better choice. But B, with the coverage that you mentioned, there's no choices there for original Medicare, right?
A B plan, is that what you're asking?
Well, if I sign up and I have to add, if I want to go in and add doctor coverage, which is B, all right, those letters only apply to the supplemental insurance plans.
Okay, so this is why I think Medicare is so complicated. There's a Part A and a Part B, but on the screen that I'm showing now, there's also Plan A, Plan B, Plan C, right? Those are entirely different things. So
no, that I understand, but the Medicare Part B, with the numbers that you had up before about the Medicare Part B itself, that is all cut and dried standard.
It's basically, yes, that's your coverage for Part B is if you go for a doctor's visit and the doctor has a particular procedure that gets covered under Part B.
Okay, so Part B is Part B. There are no choices to be made there. It is what it is, so to speak. And then, okay, the choices come when you go for the supplemental plan.
Right.
In my case, so being that I am already enrolled, but do not yet have Part B coverage, does that mean that for me, I would still be eligible for supplemental plans, plan types C and F?
Yes.
Which you said are going away?
Yeah, if you were eligible prior to January 1st, 2020, even if you didn't get it, even if you didn't have Part B, you would be eligible for F and C.
Okay, good. I have been enrolled in Medicare for 7 years.
Okay.
But I retired 3 years ago, and now I've still got my husband's insurance. So if it turns out that I like Plan F, which, by my friend's experience, she's very much for it. She's been very happy with it. I just wanted to make sure that I would still be eligible to choose that when I decide.
Right. Yeah, no, you would be. Now, we don't know what the price is going to be, because I actually check the price every month, and it changes slightly. And when we go into the new open enrollment period, it could be that those Plan Fs are going to be a very different price than what you're seeing here.
Yeah.
So,
well, I would still have to evaluate it. Now, being that my birth month is April, so for me, if I wanted to basically turn on Medicare Part B, I would have to be looking at the general enrollment period.
No, this would be a special enrollment period.
Oh, that would be the special, and I would want to do that.
Oh, wait, no, I'm sorry. You're right, because right now you're getting it through your husband, right?
Correct.
Yeah.
And for me, it's one of two possibilities. Either I decide to get off his insurance, or I stay with his insurance, depending on. So it would be I'm just looking at when the dates would be for me if I wanted to do that.
You know, I'm still thinking that would be a special enrollment period.
Okay.
So you would have 8 months.
Right, the special enrollment is when something changes. So if I
That's
wanted to
right.
switch from his insurance to mine, that is a special condition.
Right. Now, you wouldn't want to wait 8 months because you want to make sure there's no gap in coverage, but
Absolutely.
yeah, you'd want to, but I think you would have 8 months.
Okay, and then when I turn on, if I'm using the right term, if I want to turn on Medicare Part B, then at that point, I must choose a Part D drug plan or else there will be a penalty.
That's right. Yeah.
Okay, my friend fell into that hole, so she's, you know, paying a bit of the penalty.
Right.
Are there people waiting, or can I ask another question?
Well, we do have one question in
Go
the
to somebody
chat.
else and then come back if it's possible.
Okay.
I'm sorry, Catherine.
Sure, no problem. We do have a question in the chat. Is it possible to have a standalone Part D that's not an Advantage plan?
Well, in fact, standalone Part Ds are not part of the Advantage plan. So if you are getting original Medicare, because that doesn't have a drug plan, it doesn't include drug plans, you have to get, if you want to be covered for your drugs, you have to get a standalone drug plan. It's only the Medicare Advantage that's part of the Medicare Advantage plan. The Part D is part of it. Does that make sense?
Okay.
Too well,
All
but
right. Thank you. All right, Carolyn, you can ask your next question.
Okay, this is on behalf of my sister who lives in Las Vegas. She is, her birthday, she's 65 at the end of January. And she's planning on retiring at that time. So for her, January in your example is month 4. October, November, and December would be her initial enrollment period.
right.
And she's talking about somebody who she wants to work with on that, but who says that she cannot, and I don't know the qualifications of this person, so, you know, I'm a little concerned. I'm the big sister. She said that she can't work with my sister until she has her Medicare card showing that she has that she's getting Part A and Part B. So first of all, she is not in her initial enrollment period until October, correct?
Right, okay.
Okay.
November, December, yep. Mm-hmm.
So if she enrolls at that time, I know that from what I was reading last night, that her Part B would not kick in until the beginning of her birth month.
That's right.
Any idea how long it takes? Because she's going to want a supplemental plan. She's absolutely going to need a Part D. So the first, I'm trying to outline for her the order in which she needs to do things. I mean, I'm a documentation person, and I find the Medicare.gov site to be so confusing.
Really?
And if, you know, but I want to be able to help her accurately, at least to send her in the right direction. She's feeling a little anxious. So she's going to have to enroll. She's going to have to accept Medicare Part B, but that means that at the same time, she's going to have to indicate what Part D she wants.
Well, it doesn't have to be the same day, but she should, you know, soon after come up with, you know, what Part D plan she wants to enroll in.
Okay, so she's got, how much time would you say to choose a Part D?
You know, there's specific times, and I don't remember what it is offhand, but we always recommend that people do their Part D before their birth month in the same way. So she's
Sure.
say before her birth month, she should do Part D.
I mean, I'm going to suggest that, you know, is there any way that I can have her check what the qualifications of this person are with whom she's talking?
Yeah, no, I don't know that. But one of the things I was going to recommend is you or she can go on the Medicare.gov site And not sure exactly how you find it. I probably the section that talks about starting out with Medicare, there is somebody that she can talk to, and every state has somebody to talk to.
Mhm. Yeah.
And so she should find out what the organization is in her state, in Nevada, to see who she can talk to specifically about all the rules in Nevada. Because, you know, some of them are different. For example, I don't know what it would take. I don't know what the rules are for signing up for a supplement.
I know. It's different in each
Yeah.
state.
And
So
she's also going to have different plans than what I was showing for New York, even for Suffolk County. So, you know, it's just all going to be different for her. So she should probably hook up with somebody that's comparable to HIICAP,
Yeah.
where she's going to get information that is unbiased. It's not somebody trying to sell her a particular plan who comes from, you know, who's an agent, for example. So
yeah, that's the thing. I mean, I want to make sure she's not hooking up with somebody who is going to push her in a particular direction. You know, she's got certain needs, you know. So then, do you have any feeling, last question, do you have any feeling for if you enroll online, and I've already told her about the questionnaire, you know, because I remember that 12-page questionnaire, and it wasn't, you know, it wasn't rocket science, but it was kind of a pain. How long does it take, do you think, until she has the Medicare card, until she receives that when she enrolls online?
I don't know the answer to that.
Okay, yeah, that's a hard question. I'm sorry.
Yeah, right. And especially now, I don't know.
Yeah, well, everything is crazy now.
Right.
So,
but I mean, if she enrolls online, they will have a record of it. So
right.
if you're trying to enroll in Part D, let's say, then I don't know whether it asks, you know, it might ask for your Medicare number, but she should have that if she, you know, if all has gone through.
So is there something that if she doesn't have a card in her hand, what can she provide to this person who she thinks she wants to get advised by, who wants to make sure that she's enrolled in A and B?
Well, I mean, what she could do, maybe there's some, you know, she could identify the field office.
Mm-hmm.
I gave that URL for that. She can type in her zip code and find the field office and talk to somebody there. She can try
A field office for Medicare or Social Security?
Well, so to enroll in Medicare, you're actually going through Social Security. But so,
right.
So there's Social Security field offices, which if we weren't in a pandemic, you'd be able to go there in person and sign up. And the same, I'm sure, is true in Nevada.
Right, it is part of Social Security. She's not planning on taking benefits yet. I think she's going to wait. I'm not sure about that.
That's okay. She still would go through her Social Security office.
Gotcha.
Wants this kind of information.
Okay, great. Thank you so much. This was very helpful.
Okay, great.
Okay, this is Catherine. We have another question in the chat. Patty's asking, she has an aunt who's in assisted living right now, and she's her power of attorney. I will be applying for Medicaid for her in the near future. Is the Medicaid application easy enough for me to fill out? Or do you advise me to hire someone to be successful?
So Medicaid is pretty complicated. And at the end, I gave a phone number. Hang on, let me find it.
I wrote it. I wrote it down.
Okay, I would go through them. I don't like to give out any Medicaid information myself. I feel like I would just have to know so many details to be able to do that effectively and reliably. So I always tell people to go to the Nassau-Suffolk Hospital Council, because that's all they do is Medicaid, and that would probably be the best thing to do.
Okay, thank you.
Okay.
Okay, and then our other question is, do I call HIICAP to make a one-on-one appointment at the library? Actually, I can answer that. Lynn's next one-on-one morning of sessions will be October 19th. You can call the library beginning October 1st to make an appointment. The number is 631-549-4411.
Thank you, Catherine.
Okay. Does anyone else have any questions?
I have a question. My
Go ahead.
I'm retired and have insurance through New York State, which I'm told that when I'm 60, before I'm 65, I should apply to have Medicare, and then my other insurance will be the supplement.
Right.
And so I just wanted to review, when I do that, since it's through Social Security, do I need my Social Security card?
Well, it's theoretically through Social Security, but you don't have to be on Social Security to apply for Medicare.
I just wondered if, I thought I had heard someone say you have to turn in your Social Security card at that stage or something, which I haven't had for years. Do you know anything about that? No?
No.
Okay, good, good.
No, you don't have to worry about that. The only reason I mentioned Social Security field office is because that's typically where you would go in person to apply for Medicare. But, and you can't go in person now because of the pandemic, so you would call them or you know, find out where they are. But it's kind of invisible to you that when you're applying for Medicare or going to the Medicare.gov site, you're, you know, it's just basically, it's invisible that it's Social Security. It doesn't matter.
Okay. So I might have heard, you know, misinformation about that.
Right.
So then I would just do that several months before my 60th
Right.
birthday.
Okay.
Thank you.
Okay.
Okay, I think Nick has another question.
Yes, I do, and hopefully it'll be quick. We started with the initial enrollment question earlier. I just wanted to double check if you go online, is it the Medicare.gov site that you go to?
Yes.
Okay, and then it's just a matter of uploading whatever it is that they ask for.
That's right. They'll give you the instructions for it.
Okay, and if I didn't want to do it online, then what do you have to print out the forms and do it through snail mail? Is that?
That's ultimately what will happen. You probably want to send it registered or certified or something, so you have a record of the fact that you're sending things.
Okay.
But again, call your Social Security field office and find out exactly what they, you know, give them your situation and find out exactly what they require of you.
Okay, so I have no problem doing it online. I mean, there's nothing more or less advantageous to that, is there?
It's probably quicker.
Okay, that's what I thought, right?
Yeah.
Okay. And the minute as soon as you're enrolled, they let you know, right? I would assume after you've done it, they let you know electronically.
Yeah. The reason I can't specifically answer these questions is because I tried to do it myself and it kicks me out because I'm already enrolled.
Okay.
I tried to go through the whole process and I just don't know the details of the process.
Okay. All right. Thanks very much. You've been extremely helpful, and I do appreciate it.
Okay, no problem. Anything else?
All right, well, thank you so much, Lynn, for sharing your expertise with us today. It's been very helpful.
Welcome.
So as I said, if you want to meet with Lynn by telephone one-on-one, her next set of meetings will be on Monday, October 19th. You can call the library 631-549-4411 beginning October 1st to make an appointment. Thank you, Lynn. Thank you, everyone, for coming.
Okay, bye, everyone.
Thank you, Lynn. Great presentation.
You're very welcome. Take care. Be safe.
Thank you. Bye.